Jamaica's Health Minister, Dr. Christopher Tufton, says the island is amplifying support and resources in the public health system for expectant mothers in light of the Zika virus outbreak. However, he would not be drawn on the Zika virus abortion debate. Here's Peter Gay Coombs with the details.
The number of confirmed cases of the Zika virus in Jamaica now stands at 44. During an address in Parliament on Tuesday, Minister of Health Dr. Christopher Tufton revealed that from a total of 3,746 notifications of possible Zika virus infections, 2,524 of the cases are classified as suspected Zika fever, including 200 expectant mothers, 7 of them having been diagnosed with the virus, pointing out that researchers estimate that 10% of pregnant women could give birth to a child with Zika-related microcephaly. The Jamaican Health Minister says expectant mothers are being prioritized in the public health system, with medical professionals given supplementary training to handle Zika complications.
The difficulty is that even if we know that a pregnant woman has a positive result, we will not know until late in the pregnancy or after birth whether the child has microcephaly. There is presently no intervention to counter that possibility at this time, while we continue to provide supportive care throughout the pregnancy to ensure the best possible outcome.
And though abortion is illegal in Jamaica, Opposition Member of Parliament for Northwest St. Anne, Dr. Dayton Campbell, who is also a medical practitioner, is of the view that the government should go further.
I've never advocated for abortion as a means of poverty control or anything like that, but I do believe that in cases where you have illnesses, mental illness and other things that will be difficult for the families to deal with those births, that where do we draw the line? I mean, the thing with abortion is that it's not every unwanted pregnancy is due to carelessness.
We are, on this side, more than happy to engage the opposition in satisfying all the concerns. And frankly speaking, I even go further, where we can learn from your suggestions and take them on board in the interest of the public. We're certainly more than willing so to do.
Minister Tufton says that several measures are being implemented to provide the necessary support to expectant mothers and their families during the outbreak of the mosquito-borne disease, including counseling, mosquito nets, resourcing of intensive care units, additional ventilators for newborns, as well as signing on for participation in an international trial for the development of a Zika vaccine. However, he says personal responsibility is the safest guard against the disease.
We maintain and continue to advise that women and their partners, if at all possible, delay pregnancy for at least another year. Through working with PAHO, we have trained staff and established the capacity to do ELISA testing. The simplistic explanation for it, Mr. Speaker, is that this testing, it's a new test, will allow us to tell whether pregnant women ever had Zika virus or whether they are having the virus. This will eliminate the 3 to 5 day window, allowing us more flexibility to diagnose Zika infection. Mr. Speaker, we are discussing similarly with PAHO the possibility of widely introducing this test, as the cost to test 40,000 pregnant women at the current price of US $20 per test would be approximately $800,000 US.
The previous health minister, Dr. Fenton Ferguson's tenure will forever be marred by what many saw as his extremely poor stewardship of the chikungunya outbreak, which ravaged the island for much of 2014. But in defending his management of the Zika virus since taking office in March, the new health minister says there is no comparison. He also revealed that he has requested a detailed report on the chikungunya outbreak, which will be tabled in Parliament.
In that process, I have discovered that over 40 Jamaicans died from chikungunya, and another 30 odd indirectly, 40 or so directly, another 30 odd, so 70 odd Jamaicans. Directly, well, I have to go by what the technocrats tell me. And to date, member, to date, To date, I have not heard a death from Zika, and therefore I think it is fair to conclude, although there were separate viruses in terms of impact carried by the same vector, but we have done a lot better.
Peter Gay Coombs for CEEN Caribbean News.